Happy Wednesday. Welcome back to a Wednesday Night Live. And boy, have I missed you all. I hope you've been having a great week. We get so many emails saying that you passed your examinations. And so I want to let you know that we are proud of you. And let's get ready to do some practice questions. Tonight we have 25 practice questions. Of course, I'm going to bring it. I'm going to help you pass those CNA examinations, your PCT examinations. And if this is your first time here or if you're returning, go ahead in the chat. Let us know where you are watching us from. If you've not done so already, look, we have all of our CNA skills in one video, and that's going to help you whether you're taking your test in Florida or anywhere in the United States and even abroad. How do I know? Because you all message us and you tell us that. So what do you need to do? You're just going to open up your camera app on your phone. You're going to hover. And once you, with your camera app, hover over that QR code, a website's going to appear. Go ahead and tap on that website. And from there, you'll be able to see our YouTube channel with not just our CNA skills videos, but with all of our videos. Look, we want to make sure that you pass your test. I want you to be a caregiver because we need more caring caregivers like you in the world. Without further ado, because it's Wednesday Night Live, let's get right into it. Let's get you ready for your practice test. So go ahead and find a quiet space like where I am right now. Make sure you have pen and notebook. You're going to have to take some notes. As we go through, I'm going to read the questions to you and also the answers and the rationale. If you find that that is helpful, especially if English is your second language, whenever you're taking your test, whenever you're registering for your test, speak to your instructor, see if you can take the audio test instead so that your questions and answers will be read to you via a headpiece. Only you will hear them. No one's going to know that you use an audio test whenever you pass your CNA exam. My goal is for you to pass the exam on your first attempt, and so use any tools that are available to you. Lastly, let's trust your instincts. Remember, you already have the heart for patient care. You're already a caregiver. We just need to help you get certified. So question number 1, what is the minimum time recommended for washing hands with soap and water? Oh, this time I put 5 answer options. So is it A, 10 seconds, B, 15 seconds, C, 20 seconds, D, 30 seconds, or E, 45 seconds? I'm going to hydrate while you answer that question. That's right. Put it in the chat, team. I see a lot of great responses revealing the answer in 3, 2, and yes, if you chose C, 20 seconds, that is right. Friction for 20 seconds. Clean all of those surfaces and then clean your cuticles and your nails. That is according to the CDC. So when you're taking your test, either sing your ABC slowly. That means that you'll be doing about 24 seconds, or sing your ABCs twice if you're moving pretty fast. But when you're taking your CNA exam, you have to wash your hands before, care, and aftercare. And best believe that nurse evaluator is counting to make sure that you do friction for the appropriate number of seconds. Question 2, the body cavity that contains the intestines is the A, thoracic, B, spinal, C, abdominal, D, pleural, or E, peritoneal? That's right. We're doing new terms. And a lot of you have it. I'm so proud of you. Yes, it is C, abdominal. So the intestines are located in the abdominal cavity, which contains many digestive organs. Question 3. Now we're into our abbreviations. The abbreviation QOD, as used in prescriptions, means which of the following? Is it A, every hour, B, every 2 hours, C, twice a day, D, 4 times a day, or E, every other day? And not every abbreviation is going to be approved by every facility, but sometimes your patients are going to be asking you questions because there may be something in the care plan and your nurse isn't available. Depending on what that is, you can go and tell the nurse. And so, go and tell the patient. So, if something is QOD, you're going to have to know what that means. And in this instance, this is E. That is right. It is every other day. So Q is every, O is other, and D is day. Okay, don't ask me to pronounce the Latin version because you all are going to laugh at me. All right, question 4. Oh, this is a good one. How many chambers does the human heart have? And what is there or are there primary functions? Does the heart have 2 chambers, B, 3 chambers, C, 4 chambers, D, 5 chambers, or E, 6 chambers? And while it doesn't tell you the primary function, there's only so much you know as far as being a CNA. And so when you get to nursing school, that's when you have to know like the functions of the different chambers of the heart. But for me today, just how many chambers does the heart have? I know this one's tricky. We're torn. We're getting mixed answers here. All right, revealing the answer in 3, 2, and yes, it is C, and the crowd goes round. So you have 2 atria, that's the top chambers of the heart, and then you have 2 ventricles. So the atria, they receive the blood, and the ventricles, the bottom part, they pump the blood out. So again, if you look at the image, remember you can always screenshot, take a photo with your phone if you want to just go back and review. But yes, so you have your right and your left atrium, and then your right and your left ventricle. Question number 5. Which of the following suffixes refer to pain? Is it A, phagia, B, dis, C, algia, D, lysis, or E, megaly? And I want you to think about the terminology I've been teaching you. What is the difference between a prefix and a suffix? Because that's going to help you pass your test if you can understand what some of these words and terms mean. A prefix comes before the word to change the meaning, and a suffix goes after the key term to change the meaning. So for this one, you all, it's not B, it's not dys or dis. Even though dis could mean discomfort, that's a prefix. This one, I even bolded, I put suffix. So it's going to be C, algia. So the suffix algia refers to pain, such as neuralgia, as in nerve pain. But great job for guessing, you all. Question number 6. A CNA takes a resident's radial pulse and counts 48 beats per minute. The resident reports feeling dizzy. What should the CNA do next? A, encourage the resident to walk around for exercise. B, recount the pulse for 15 seconds and then multiply that number by 4. C, offer fluids to increase the heart rate. D, record the finding as normal. Or E, recount the pulse for 1 full minute. And I know what you want to do, but I need you to do the right thing for your patient. So I'm going to give you a few seconds to put that answer into the chat. Yes, yes, yes. No, we're not counting for 15 seconds and multiplying by 4, because anytime something is irregular, you need to count for 1 full minute. The answer is E. So a pulse below 60, that's referred to as bradycardia, is abnormal. The CNA should verify accuracy by recounting, and you can also check the other vital signs. Look, you're going to be calling the nurse in anyway, and guess what the nurse is going to be asking you? Hey, what's the blood pressure? Because believe me, if the heart rate is low, that means the heart isn't pumping effectively. Well, that means there's not adequate blood flow. So there may also not be adequate oxygenation, so their O2 sat could be low. It's going to take you maybe 2 minutes max to get all that done. So by the time the nurse comes into the room, you will have a full set of vital signs. But even for your CNA test, whenever you're checking the pulse, the radial pulse, you have to count it for 60 full seconds, 1 full minute. Question number 7. A CNA measures an oral temperature of 102.4 degrees Fahrenheit. After the resident recently drank hot tea, what should the CNA do first? A, record the temperature immediately. B, wait 15 minutes and recheck the temperature. C, give cold water to lower the temperature. D, switch to an ear or a tympanic thermometer. E, notify the nurse stat. Patient's oral temperature is 102.4 degrees. That's right. I couldn't trick you. It was 102.4 degrees after they drank hot tea. Of course, that's going to happen. The tea has changed their temperature. So it is going to be B. You have to wait and come back and recheck. So oral temperatures are inaccurate if the resident has eaten, smoked, or drunk something hot or cold within 15 minutes. Retesting ensures reliable results. Question number 8. The pulse oximeter reading on a COPD patient is 84%. The CNA verifies the probe placement and finds that the reading is unchanged. What is the next appropriate action? A. Asks the resident to take slow, deep breaths while staying calm. B. Remove the probe and ignore the reading. C. Apply a new probe to the same finger. D. Increase the resident's oxygen flow rate. Or E. Notify the nurse stat. And this one should be an easy one for you all because I know you're great caregivers. And just as I suspected, you are, because you know the 84%, even for a patient who has COPD or chronic obstructive pulmonary disease, that's way too low. The answer is E. Get that nurse in the room. So here's our rationale. A pulse ox reading of 84% is a critical finding, even in a COPD patient. While these patients may have lower baseline oxygen levels, a reading below 88 to 90% indicates severe hypoxemia and potential respiratory distress. Since the CNA has already verified probe placement and accuracy, the next correct action is to immediately report this abnormal result to the nurse. Number 9. While providing catheter care, the CNA notices cloudy, foul smelling urine in the drainage bag. What should the CNA do next? A. Record the observation accurately and monitor the output. B. Tell the oncoming CNA without documenting the findings. C. Flush the catheter with sterile water. D. Replace the catheter tubing. E. Empty and clean the drainage bag with bleach. Cloudy, foul smelling urine in the drainage bag. What do you want to do? I see a few conflicting responses, but the majority of you chose correctly. The majority of you chose A. That's right. You are going to record the observation accurately and monitor the output. Of course, you're going to let the nurse know, but you need to go ahead and actually document too. So, cloudy or odorous urine suggests a urinary tract infection. CNAs must accurately document observations and continue to monitor for worsening changes. Question 10. The abbreviation meaning immediately is which of the following? Is it A, PRN, B, STAT, C, QOD, D, ad lib, or E, DC? I know that was a lot. When you take your test, you only get 4 answer options, but I wanted to make this a little more trickier for you all. So I'm going to start giving you all 5 answer options. And yes, you're right. It's B, stat, easy one. The abbreviation stat means immediately, derived from the Latin word statim. Question number 11. A CNA notices a resident with labored breathing using their neck muscles to breathe and cyanosis around the lips. What is the immediate action? A. Help the resident to a prone position. B. B. Place the resident flat on their back. C. Help the resident into a Fowler's position. D. Begin chest compressions. Or E. Leave the patient as is until the nurse arrives. And notice what I'm doing here. I'm including a lot of questions or answers that say notify the nurse or contact the nurse. Because when you're taking your CNA examination, if you are notifying the nurse for everything immediately, that means you don't know your scope of practice. So we have somebody who has labored breathing, they're using their neck muscles, and you're watching them. What are you going to do while you're watching them? That is right. We're not going to keep them laying down. We're going to do C. You have to sit them up. So help the resident into a high Fowler's position. Prone is when they're face down. Supine is when they're laying on their spine. Take the U out. Supine is when they're laying on their spine. No one should be flat if they're having respiratory issues. So sitting upright in the high Fowler's position eases breathing by expanding lung capacity and improving oxygen exchange. So as the nurse, if you call and tell me that my patient's short of breath, when I walk into the room, unless that patient has had a back surgery or something else indicates the reason they can't sit up, I'm expecting for them to be upright to their tolerance. Okay. Question 12. A resident who was recently treated for a UTI, urinary tract infection, suddenly becomes confused. They have a fever of 101.8, a rapid pulse of 118, and clammy pale skin. These signs most likely indicate which condition? As a CNA, you don't diagnose, but you're going to learn a lot, and you're going to learn to get the nurse into the room. So if your patient has all of those symptoms, do you think that they have A, hypoglycemia, B, dehydration, C, anxiety, D, sepsis, or E, heart failure? Put all that together. What do you think is going on with your patient? That is right. Come on, fever, increased heart rate, pale, sweaty skin, and they're confused. Oh, that must be something major. So it is D, it is sepsis. And so that combination are hallmark signs of sepsis, which is a life-threatening condition sorry, it's so loud, caused by the caused by the body's extreme response to infections. CNAs must be able to recognize these early warning signs and report them immediately, as untreated sepsis can quickly lead to organ failure and death. Early detection and rapid medical response are critical to saving the resident's life. Great job, team. Question 13. And remember, we're going all the way to 25. And so if you've stayed this far, you haven't liked, if you haven't shared our videos, or let me show you all this, because we would not have gotten this without you all. So thank you. If you have not subscribed, I need you to go ahead and do so. And so, yes, I have two channels. We have Florida Training Academy, but then we also have Nurse Eunice, and then we have Boss Nurse TV. And that's for those who are interested in turning their skills into profits. Yes, we train nurses, CNAs, doctors, whoever, in order to turn their skills, their knowledge into something that's monetizable. And so if that's you, check us out on YouTube at Boss Nurse TV. All right, so let's keep going. Question 13. Which term describes the opposite of being unconscious? Is it A, sedated, B, disoriented, C, alert, D, asleep, or E, paralyzed? The opposite of unconscious. All right, so these are all terms used to describe your patients, okay? Is the patient sedated? Are they disoriented? Are they alert? Are they asleep? Or are they paralyzed? And so for this one, the opposite of unconscious is, of course, they must be alert. They're arousable. So the answer is C, a patient who is fully alert, awake, and responsive, which is the opposite of being unconscious, where a patient is unresponsive to stimuli. And sometimes your patients may be responsive to pain. Like if you do a sternal rub, they won't wake up and have a full conversation with you, but their eyes may flicker or they may moan. So they have different levels of unresponsiveness. Some, that if you start touching them, they may respond, versus if you're just talking to them. So you'll learn more when you're in the facility, but even someone who is unresponsive can still let you know if they're in pain. How would they do so? They may start grimacing. They may start making some their facial features may change. If they're on a telemetry monitor, a heart monitor, maybe their heart rate goes up. Or if you take their blood pressure, you may see their blood pressure changed. So even your unresponsive patients still have a response to painful stimuli. And on top of that, you still have to talk to them, because hearing is the last sense that a person leaves. I keep misspeaking. Hearing is the last sense that a person loses. Look, it's been a long day, so don't judge me. Question 14. A resident's pulse oximeter reading is 88%. The respiratory rate is 26 breaths per minute, and the skin appears bluish around the lips. What condition is most likely occurring? Is it A, dehydration, B, hypoxia, C, hypoglycemia, D, stroke, or E, bradypnea? So O2 sat 88%. Respiratory rate is 26. The lips are bluish. Does it sound like they are adequately oxygenated? Absolutely not. So which term refers to oxygenation? And you are so right. Yes, it is B. Remember those prefixes. Hypo means low. Oxio refers to their oxygen level. So the correct response is B. And here's your rationale. A pulse oximeter reading below 90% indicates inadequate oxygenation. Rapid breathing and cyanosis or blue lips further confirm hypoxia, a dangerous lack of oxygen that requires immediate attention. Question 15. During your shift, a nurse says, let's use cluster care for Mr. Adams so he can rest. We're never going to use that term. We just expect you to do it. So, what should you do? A, provide only hygiene care and skip the rest. B, plan to do all patient tasks at once to minimize disturbances. C, document care every 30 minutes. D, spread out care over the shift so nothing is missed. Or E, all of the above. We're going to provide cluster care. Something that you're going to hear your patients complain of is that we're always bothering them. They can't get any sleep. Someone's always in their room. And so, in addition to clustering care, work with your nurse. Your nurses work with your CNAs so that we, maybe only go in the room every hour versus every 30 minutes. But whenever you're clustering care, yes, it is B. I need you to do all your tasks, as many as you can at one time, to give that person time to rest. Here's your rationale. Cluster care means grouping tasks like vital signs, repositioning, and hygiene into one visit to reduce frequent interruptions and allow the patient more time to rest and recover. So I want to talk about that. Vital signs, repositioning, and hygiene. If you have to do all three while you're in the room with the patient, which do you do first? Which do you do second? And what do you do last? Oh, that's right. Let's see if you can cluster care. Put it in the chart. Go ahead and put it in the chat. Whether you're right or wrong, it doesn't matter. I just want to make sure that you're thinking about it so that you can save time. And so I'm not going to reposition anyone to provide hygiene and then do their vital signs because that's going to alter their vital signs. I'm going to get their vital signs done first. And then I'm going to do their hygiene, okay? Because we start from the front. So when I get them to their back or when I get them on their side, I can clean their backside. I can put that pillow beneath their back and look, I did the hygiene, I repositioned them. So my order would be vital signs, hygiene, repositioning. Let me know your order. Question number 16. You walk into a room and see a patient struggling to breathe and turning blue. You press the call light, but no one answers quickly. What should you do next? A, wait for your assigned nurse. B, call housekeeping for help. C, begin charting the event. D, activate rapid response team. E, leave the patient and go find the nurse. They're struggling to breathe. They're turning blue. You're pressing that button. Secretary's not there. No one's answering. What are you going to do? This happens. Okay? One thing you can do is you can start screaming out help. But something that you're going to do that's going to alert the entire floor is you're going to do D. You're going to press that code button. Okay? You're going to activate the rapid response team. And so that's going to make the alarm inside the room, and there's a light outside the room. It's going to flash. Everyone within your vicinity is going to hear that there's an emergency in your room. So the rapid response team is called for early signs of clinical deterioration to prevent cardiac or respiratory arrest. CNAs, PCTs, and family members are encouraged to call RRT if immediate help is needed and nursing staff isn't present. Okay, save your patient. Question 17. You are assigned To a patient with a DNR order. During care, the patient becomes unresponsive and has no pulse. What is your immediate responsibility? Remember your CNA. Is it A, begin CPR immediately? B, call the family and notify them? C, call a code blue and begin chest compressions? D, begin post-mortem care before rigor mortis sets in, that's the stiffness? E, notify the nurse without starting CPR. Yeah, I know this one's a little tricky for you all. What does a DNR order mean? It means that we're not going to be performing resuscitative acts on that person. They've decided to go without having CPR, but you just can't begin starting postmortem care without your nurse. Your nurse has to tell you when to start postmortem care. So the answer is going to be E. If there's a change in your patient's condition, yes, you're going to be notifying your nurse. So E, you're going to notify the nurse, you're not starting CPR. A DNR, or a do not resuscitate order, means no CPR should be started if the patient stops breathing or if they do not have a pulse. CNAs and PCTs should alert the nurse immediately and then follow the care plan. So as the nurse, once you call me, I'm going to put my stethoscope to the chest. I'm going to listen for a heartbeat for 1 minute. I'm going to note the time that you told me, that you found the person without a pulse, but it's going to be officially documented when I listen. But I do not pronounce death. I have to call the doctor. Hey, doctor such and such, because they may not be on the floor, especially if you're in a nursing home or in hospice. So I'm going to call the doctor and say, hey, at 8:26 p.m., this particular patient, of course, give the patient information. There are two identifiers. They did not have an apical pulse. So whenever your nurse puts the stethoscope to the chest, she's listening to the apical heart rate. She doesn't feel, she actually has to listen. And then the doctor will announce the death. And then after all of that, that's when your nurse will give you the clearance to go ahead and start doing postmortem care. If you're interested in postmortem care, just go to our channel, Florida Training Academy, and you can type in end of life, you can type in hospice, and you're going to see our videos on how to do postmortem care. Question 18. While assisting a nurse with patient care, you overhear that the patient is now a full code. What does this mean? A, the patient should not be disturbed. B, the patient refuses medication. C, CPR and all life-saving measures should be performed if needed. D, the patient can now eat a full meal. Or E, bring the crash cart and place it outside of the room door. And I think that would be a good video. So if you want me to actually do a video on what's inside of a crash cart, what's on top of a crash cart, I think that's a good video. Let me know and I will do so. All right, but in this case, your patient is now a full code. So what does that mean? That means that they reversed their DNR. They changed their mind and now they want C. They want all life-saving measures. Okay, so a full code means the patient has chosen to receive all possible resuscitative efforts such as CPR, defibrillation, and intubation, because they could be a limited code. Some people don't want blood products. We have to know that. And so those would be decisions that they have to make, preferably like as soon as they come into a facility. We're asking them about their code status, because we don't want to wait until the emergency happens and then have to contact a family member. So we want to know all this information as part of the admission process. Question 19. A resident weighed 150 pounds yesterday and 144 pounds today. What should the CNA consider first? Would it be A, the scale must be broken? B, the resident may have fluid loss? C, the resident exercised too much? D, weight loss is normal in older adults? Or E, the patient had a bowel movement? They literally lost 6 pounds in one day. Is that normal or abnormal? I know that's what we want to do, but this person was already underweight, 150 pounds. And depending on their BMI, they're either underweight or, they're probably at their normal adult weight. They lost 6 pounds. So what are you considering? And that's right, team. More than likely, this patient was given a diuretic. So it's B. A sudden 6-pound loss in 24 hours likely indicates fluid loss. They should not be dehydrated in your facility. So we know it's not dehydrated, but maybe they had congestive heart failure or they had a lot of fluid. And so the doctor prescribed something that made them urinate, that made them get rid of all that extra fluid. Or maybe they were a dialysis patient who went to dialysis. So CNAs must weigh residents consistently. Some of your residents will have daily weights, and you're going to have to report unexpected changes for evaluation. So never assume that the person had a bowel movement that was so large that made them lose 6 pounds. That doesn't happen overnight. More than likely, there was some fluid loss somewhere. Notify your nurse so she can find the reason that this person has lost this much weight. Question number 20. A CNA is caring for a patient who speaks limited English. To help the patient understand bathing instructions, the CNA uses her personal cell phone to access a free translation app. Which rule or guideline did the CNA likely violate? A. The CNA failed to complete charting in a timely manner. B. The CNA violated infection control policies. C. The CNA acted appropriately by taking initiative. Or D. The CNA used an unapproved method for patient communication and breached confidentiality. Oh, I don't even have to wait. You all know the answer is D. I know there's Google Translate. I know there's Chat GPT. None of that can be used with your patients, not by you, not by another medical staff, because they're not sworn to confidentiality laws. Okay, so the answer is going to be D. While well intentioned, using personal devices or unapproved translation services can lead to HIPAA, confidentiality violations, and inaccurate communication. Facilities typically require the use of hospital approved medical translators and interpreters. And they have phone lines where you can actually, once you find out the person's country of origin or the language they speak, you're going to call this certain number. I'm just going to say AT&T. They have their interpretation line, and it's going to be an interpreter who is going to, for word, interpret everything that you, me, or the doctor says to that patient. And so that helps to protect patient privacy and ensure safe, clear communication. We can't use the family because the family is going to ad lib. The family is going to change the words around. Or what if what I'm saying to the family, they don't understand? So if it's something simple like stay in the bed, yes, I can let the family member translate that. But if it's something about a medical procedure, I have to use one of the approved translation or interpretation services. Question 21. A CNA empties a resident's catheter bag at 2 p.m. and records 100 ml. Remember, for your Florida test, it is not mLs, it's cc's. They're equivalent amounts of fluid, but some facilities prefer the term cc's or cubic centimeters more than mLs, milliliters. So, all right, I digress. A CNA empties a resident's catheter bag at 2 p.m. and records 100 mLs of urine for the past 4 hours. Which finding is most accurate? A, normal output. B, decreased output. C, excessive output. D, output cannot be determined. And then E is anuria. So 100 mLs of urine in the past 4 hours. What do you think? So medicine cup is 30 mLs. So that means that in 4 hours, your patient had nearly 3 medicine cups worth of urine. Do you think that's normal? Absolutely not. It is not normal. The answer is B. They're having decreased output. So here is what we expect normally. Normal urine output is approximately 30 mLs or 1 medicine cup per hour. And now if they're drinking, eating, they have IV fluids, what goes in should be matching what's coming out. So that's why we have you monitor everything that's going in. With this one over 4 hours, the expected amount of urine should have been at least 120. While this total meets the absolute minimum, it's borderline low and may indicate decreased kidney function, dehydration, or poor perfusion if the pattern continues. CNA should monitor closely and ensure accurate documentation of ongoing outputs to identify trends that require follow-up. And it depends on where you're working at. If your patient is NPO, they can't have anything to eat or drink. Well, we're not expecting for them to have a whole bunch of urine output because nothing's going in. But if they are eating and drinking and nothing's coming out, yes, you're going to document, but you also need to go tell your nurse. Question 22. A CNA observed swelling in both ankles, shortness of breath, and a sudden 4-pound weight gain overnight. What is the likely cause? Is it A, dehydration, B, sleep deprivation, C, poor appetite, D, fluid retention, or E, sickle cell anemia? And I talk about this in almost every video. It's classic telltale signs for which condition? Yeah, great job. You are right. This person more than likely is retaining fluid. So the answer is D. Edema, weight gain, and shortness of breath are signs of fluid retention, often due to heart or kidney problems. Monitoring weight and fluid intake is crucial. Some of these patients may end up being on a fluid restriction. Remember, you and I, we cannot restrict anyone's fluid, even if they're incontinent, even if they keep wetting themselves. We cannot restrict their fluid without a doctor's order. So if the doctor hasn't ordered a fluid restriction, you just have to keep reminding them, hey, Miss Gail, remember your legs are really swollen, so maybe let's not have the chips, let's not have this. And if you don't feel comfortable, you're going to come and tell me, and I'm going to remind her. Because if she's eating a whole bunch of salty food, then of course the fluid is going to follow the salt. And as a CNA, something you could do to help with the swelling is have them raise their legs and get them up and take them for a walk. Question 23. The term tachycardia means A, slow heartbeat, B, fast heartbeat, C, irregular heartbeat, D, absent heartbeat, or E, fast breathing. Does tachycardia mean? And I am so proud of you all. I see you all in the chat saying that you passed your exams. I am so proud of you. So much success to you, not just in your CNA journey, but a lot of you all from here are going to be phlebotomists. You're going to learn EKGs. You may even go to nursing school, respiratory therapy school, sonography school. So whatever you decide to do, I am proud of you. And so, yes, for question 23, tachycardia isn't necessarily irregular because they can have a regular fast heartbeat. So the answer is B. When you put tachy in front of a word, it means fast. So the prefix tachy means fast and cardia refers to the heart. Thus, when you put those two words together, tachycardia means a fast heartbeat. 24, this is long. While assisting a resident during lunch, the patient suddenly begins coughing, has trouble breathing, and is scratching their neck. You hear wheezing, but they are not turning blue and they can still speak. What should you suspect and what is your next action? A, the patient is choking. Perform the Heimlich maneuver immediately. B, the patient is experiencing heartburn. Offer them water. C, the patient may be having an allergic reaction. Notify the nurse immediately and monitor for signs of anaphylaxis. Or D, the patient is sleepy. Encourage rest. Now, is it just me? But what does scratching their neck have to do with being sleepy? So some of these you can immediately weed out. So I know you're torn between A and C. But when someone is choking, are they able to speak? Remember, this person is not turning blue and they can still speak. So this is not a choking emergency. It is C, more than likely they've eaten something or maybe the nurse gave them a medication. So the patient may be having an allergic reaction. Notify the nurse immediately and continue to monitor for those signs of anaphylaxis, which can cause their throat to swell. So anaphylaxis can mimic choking, but often includes wheezing, itching, rash, or swelling, not just airway blockage. If a patient is wheezing, can speak, and is showing signs of allergic reaction, this could be anaphylaxis, which requires immediate nursing and possibly emergency intervention, such as an EpiPen or epinephrine. Question 25. You're assisting a patient in a room when the patient suddenly clutches their chest, complains of severe pain, and appears sweaty and short of breath. The nurse says, we may be dealing with an MI. What is happening? So what does the term MI mean? A, the patient is having a cardiac arrest and needs CPR. B, the patient is having a stroke. C, the patient is choking and needs the Heimlich maneuver. D, the patient is having a heart attack and needs immediate nursing and medical care. What does MI stand for? Yes, yes, yes. Great job. So an MI is a myocardial infarction. Myocardial referring to the heart. Infarction refers to tissue death. Part of the heart is dying. So that is what we mean by the person's having a heart attack. It's not cardiac arrest. It's that the blood flow to a certain part of the heart is no longer perfusing in that area. So that's why the person still has pain, but they're able to talk to you. Cardiac arrest is when everything just shuts off because the heart has an abnormal electrical activity. And when that heart stops, when blood stops pumping to the brain, they collapse, they're not moving. That's the difference. So cardiac arrest requires CPR. Meanwhile, an MI or a heart attack requires the nursing team. Here's our rationale. An MI is a heart attack where blood flow to part of the heart is blocked. The patient is usually awake but in pain. Cardiac arrest, on the other hand, involves the loss of consciousness. There will not be a pulse. Remember, if there's an emergency, person's not talking to you, you do not feel for a radial pulse. You're going to feel for the carotid pulse. Whenever a person in cardiac arrest, it requires immediate CPR and defibrillation. Look, team, guess what? Yes, we have our study buddies and our scrubs and ambition channel memberships. And so I came on Sunday, and even though you all are part of the channel members, you all didn't show up. So I need to know, are you going to be available on Sunday? I try to come on Sunday at 6. Maybe this week, well, I have class on Saturday. Maybe I can come on earlier on Sunday, but I want to give you live videos just for our channel members, but I need for you to actually be able to attend. So once you join either at the Study Buddies level or the Scrubs and Ambition level, you're going to see free downloads. I put a download in on Sunday that talks about the top 10 reasons that CNAs fail their examination and how you could not be one of those. And so let me know what you want to see in the group for this upcoming week. I'll go ahead and I will create that ebook, that study guide, and I will have it available because I appreciate you. And I want to thank you for being one of our members. So join the community. How do you do that? You go to youtube.com/Florida training. If you have not subscribed, it's initially going to say subscribe. If you are subscribed, it's going to say join. And when you join, you'll see the different membership tiers. As we always say, caring CNAs make caring nurses, caring doctors, caring phlebotomists, caring sonographers, wherever that word is. So there are so many things for you to do when you're starting it off the right way, because you're starting off at, just a basic level. You're learning communication. You're learning how to turn patients. You're learning how to work with your peers, with other colleagues. And so you all know how much I appreciate you. Thank you all. Thank you all. Remember that this would not be possible without you. Yes, we have our gold play button for having over 1 million subscribers on our YouTube channel. That is Florida Training Academy. And so we did that. We did that together because you all like to study and I love to teach. So guess what, everybody? Thank you for watching. Don't forget to like, share, and subscribe. You can go to our website, fltraining.com. We have free resources. We have our online CNA. Look, we probably get about 5 different people who register into our online CNA course every day. So we appreciate you all. And I just want to thank you. And if you're part of our membership, I'll see you on Sunday. Otherwise, I'll see you next Wednesday for Wednesday Night Live. Share the video, share the video, share the video. See you